because this is where it starts to get interesting. So, heads up. What do all of these have in common? All the following: gastroparesis and IBS, dysphagia, difficulty with speech, sleep disorders, GERD, low gallbladder ejection fractions, liver enzymes are off, bradycardia, tachycardia, palpitations, insulin resistance, a decrease in immune system, as we talked about, an increase in inflammation, drastic increase, and the HPA axis going wild. One thing can control all of those. Any ideas? Okay, I have to give you a hint here. Does that give you any ideas? Just kidding. Love PowerPoint. Okay, that's my internal jugular vein. And now, thanks to Dr. Hickey, is a slice from my fMRI. The blue arrow points to the internal jugular vein. The red arrow points to the slightly more normal side. That's big. Okay, that's too big. That's a big honking one is what that is. Now the yellow arrows point to the internal carotid artery. There is a nerve that is ensheathed in the carotid sheath with those two structures that is involved. Here's a drawing to kind of make it clear. You can see the IJV here, and now imagine it getting very large and slightly increased pressure. There's the internal carotid artery, which the pressure is much higher. It's going to push right back, right? What is going to take the hit is the vagus nerve. And again, they're ensheathed together in the carotid sheath. So vagus nerve compression. Whoa. Here's a beautiful sonogram showing the common carotid artery in the IJV. The white arrow points to the vagus nerve. That really got me thinking. The vagus nerve, as you know, is the parasympathetic nervous system pathway, basically. It's the cholinergic anti-inflammatory pathway. So when that is not functioning well, we get more inflammation. We get more inflammatory cytokines. It's mainly afferent fibers. So it communicates with the organs to the brain both ways, but definitely from the organs to the brain, it tells the brain the state of the organs, and that can communicate back. If that communication is lost, we can lose quite a bit of proper organ function. Now, it's also considered to be the interface between the brain and the immune system. Now, this I found amazing because the macrophages, which come in, for example, in MS and help clean up, or what we believe to clean up the mess of broken myelin, etc. Well, when they are not under control of the vagus nerve, if that vagus nerve is compressed, all the rules change. The macrophages actually release tumor necrosis factor, the big daddy inflammatory cytokine. And there is one spot on the macrophages that the vagus nerve controls. It's called the peripheral alpha-7 subunit containing nicotinic acetylcholine receptor. Okay, and that prevents that release of TNF in a normal, healthy patient, but not if the vagus nerve is involved. So this, of course, since the parasympathetic nervous system now is not working as well, the sympathetic nervous system is overriding everything. And what that does is dumps into our bodies all these catecholamines, norepinephrine especially for us, epinephrine, and what do those do? They drastically increase inflammation and the output of inflammatory cytokines. Here we go again. And they drain magnesium. I think it's important to know in Ehlers-Danlos patient, all of our cells intracellularly are low in magnesium. In multiple sclerosis patients, the erythrocytes are low in magnesium. The vagus nerve also helps control the HPA axis. So imagine if the hypothalamus is not receiving the proper signals, it's kind of garbage in, garbage out, which would explain that. One branch of the vagus nerve also goes to the right recurrent laryngeal nerve, which can explain why so many of us and MS patients and our other family members start to lose our voice and we get hoarse voices, and yet some of us can recover that immediately after angioplasty if some of that pressure is removed from the vagus nerve. Now, what does all this mean? I think it's exciting. I think it means a lot. Vagus nerve compression, secondary to CCSVI, it explains, for example, why angioplasty helps with some of the symptoms immediately, why so many conditions seem to occur in the same patient or in the same family members. If you look at the family tree of patients such as us, we call it the family cactus because you'll see Uncle Joe has MS, Sister Sally has EDS and bipolar, and somebody else has RA, and somebody else we don't know what they have, but they've been in bed for 20 years, and then there's mental illness, so-and-so committed suicide. It's a family cactus for sure. I believe that there are many, many more conditions that are involved with CCSVI than we've ever considered before. I think it's time to take a look at those. Now, illnesses that may be caused by CCSVI and vagus nerve compression, a lot of the science has already been done. This is not Dr. Diana saying this. These conditions, scientists have already tested vagus nerve function. It's very easy to do with a tilt table test, a sham eating test if the intestines are involved, an RR interval test, for example. It's fairly easy to test for vagus nerve function. But multiple sclerosis, Ehlers-Danlos, POTS, by almost definition, POTS is vagus nerve dysfunction. Lyme disease, they have orthostatic intolerance. Alzheimer's, Parkinson's, chronic fatigue syndrome, they suffer from vagus nerve problems. Fibromyalgia, whatever that means, that was a little bit of a hodgepodge there, but I believe a lot of them suffer from that. Type 2 diabetes, how huge is this? But again, if you think about, if the communication is lost to the pancreas, that we're not getting the signal on how much insulin to produce. That's not good. And metabolic syndrome also. And again, metabolic syndrome, it's not just me. Studies have already been done showing that the heart rate variability, the RRIT, or with the tilt table test, that there's an abnormality of the vagus. Nobody has linked that with CCSVI before. And you know why I think that is? They weren't looking. I think too many neurologists, forgive me for the neurologists who are here, God bless you, but I know my neurologist wouldn't even look at my results. I think had they looked at that and kept an open mind, they would say, you have every symptom of vagus nerve compression, which I did. The vagus nerve controls every organ between the neck and the lower third of the intestine except for the adrenal gland. And as we get sicker and sicker, our organs show this happening, which is certainly occurring to me. Conditions that may be caused that are not necessarily diseases, but ones which doctors fight with and they just can't fix and they're so frustrated with. IBS and gastroparesis, I think it's very underdiagnosed as a vagus nerve problem. Gallbladder disease, idiopathic liver fibrosis, ileocecal valve dysfunction. The only thing that controls the valve between the small and large intestine is the vagus nerve. By definition, if you have ileocecal valve dysfunction, you have vagus nerve dysfunction. And guess who was diagnosed with that 2 weeks ago? I am here against my doctor's best wishes because I do have that. Inappropriate sinus tachycardia syndrome, kind of the dumping ground for most cardiologists, right? Our heart rates are too high because the sympathetic system is way overriding this defunct parasympathetic system. But the cardiologists didn't know what to do with that, so they just kind of put us in that lump. Neurocardiogenic syncope, organic brain disease, panic disorders, and chronic anxiety. I do think mental disorders definitely are related. I personally went through organic brain disease for 2 weeks before I started mast cell treatment. Dementia, suicide ideation, bipolar presentation, and I could recognize it, but I couldn't control it. 2 weeks later, it was gone. Panic disorders is oftentimes the very first symptom of POTS and Ehlers-Danlos. And we also have low-level chronic anxiety from basically birth, which can exhibit as anxiety, OCD, or as overachievement. So, sleep disorders too. And if you can imagine, if our sympathetic system is on overdrive and our parasympathetic has stopped, we have trouble. We have weird sleep cycles. And as we get older and that internal carotid artery becomes stiffer with atherosclerosis or what have you, then it's going to push back more onto this vagus. Now, what can we do right now? I'd say, one, increase intracranial pressure. That was huge help for so many people. Decrease brain inflammation. Control mast cells. That's easy to do. and that stops some of the amplification. There are medications focused on particular inflammatory cytokines, and I myself have started on one, and wow, what a difference. I believe that controlling the inflammatory cytokines may prevent our valves from going bad, and it may prevent restenosis. Angioplasty, after the inflammatory cytokines are controlled, is the time to do that, okay? We want to maintain control of inflammation, and restoring the vagus nerve function is going to help do a lot of that for us. Now, if the vein cannot shrink enough after CCSVI angioplasty, then we may need to look at vagus nerve decompression. There's an external one that I really want to look at in Germany, if anybody knows anybody in Germany. It hasn't quite made it to the States yet. We want to recognize and treat hydrocephalus, even the ones that are so underdiagnosed. And we want to start testing the vagus nerves and educating physicians. So take-home message here, I think, is vagus nerve compression, CCSVI, cytokine imbalance is causing much more than we ever realized. We're going to change the world with CCSVI one brain cell at a time if we have to. So I thank you so much.